Welcome to the Pindrop Podcast, a podcast where we discuss all things about hearing loss and cochlear implants. We'll be talking to researchers, scientists, surgeons, audiologists, associated health professionals and clients about their life and work, what inspires and motivates them. My guest today is Prof Suzanne Purdy, Head of the School of Psychology at the University of Auckland. A pioneering speech communication researcher, Professor Purdy has been researching communication disorders for more than 20 years and helped found the speech science programs at the university. She is a passionate believer in the critical importance of communication as a key life skill. Suzanne has said that being able to communicate our thoughts and feelings is something we tend to take for granted, so it's not really widely appreciated how significant it is for people when their ability to communicate is impaired. Speech, language and hearing problems can have significant effects on well-being and relationships and often lead to more generalised social withdrawal. These difficulties have a real impact on quality of life and mental health. Welcome, Suzanne. Thanks for being with us today. Suzanne, when you started out as an undergraduate student, did you know this was the area you wanted to specialise in?
I was interested in psychology because of experiences with my family. So I picked up psychology and then I really liked psychology. So then I thought I would become a clinical psychologist. But then I got towards the end of my bachelor's degree, and because I'd been very young when I started, I was still very young, and I thought, I'm still too young for anybody to take me seriously in that sphere, so I'll do my master's. And then I ended up doing my master's and picking a thesis topic in the hearing area and meeting people with hearing loss for the first time. So that's how I stumbled into it.
You mentioned that you met people with hearing loss, Suzanne. So what motivated you to dedicate your career to researching communication disorders and to developing speech programs? Was it from that initial meeting with people who were affected by hearing loss?
Probably, because when I think back, I don't really remember people in my childhood who couldn't hear. And when I did my research for my master's, I did a very, very boring listening test with people that involved them coming back to the laboratory for hours to sit in a sound booth and listen to these little sounds and push a button to show that they'd heard the difference between these little sounds. But because I had to engage with these people and give them lots of cups of tea and give them breaks, then I would talk to them about their hearing and their sort of stories. And, the paper was published from my master's in 1981, and I do have an idea of the data in the paper, but I still remember some of the stories
that was
from the individual people that are not in the research paper really at all, in terms of how people were affected in their lives by their hearing problems. People sort of from young to older participants I met.
Because I think, the human face gives a story to the data, because it's not the data that creates the emotion and drive and passion and dedication, is it? It's the people that you meet along the way. Yes.
And then one of my lecturers told me about audiology, which I didn't know about, and said, you seem to be interested in this. Why don't you study audiology in Melbourne? And that's how I found out about it, because she knew about what I was doing and how I was interested in it. And then I got a scholarship to Department of Health scholarship to study audiology in Melbourne. Before it was an academic program in New Zealand.
And how long was the course in Melbourne?
So if you had a master's degree in psychology, you could do a 1-year postgraduate diploma in audiology before we had our New Zealand master's programs.
And did you stay in Melbourne, or did you bring that knowledge straight back with you after you'd finished?
I was obliged to because of the conditions of my funding.
Yeah.
But other people had a holiday. I finished my study on Friday and I was at Auckland Hospital at 8 o'clock on Monday morning.
Wow.
And started work, a lot of work, because it was very busy at Auckland Hospital. Still is, but really busy in 1981.
And how long did you work for as an audiologist for at the DHB?
So this is before DHBs, right? Auckland,
before my time.
Did Auckland Hospital Board.
Yeah.
I was there, I think, for about 3.5 years, and then I got invited to participate, to undertake some research.
Right.
Because I was thinking I would leave the profession and maybe study as a medical doctor to learn, because I thought I could do more about all of these hearing and ear problems that I encountered at the hospital if I had medical training as well.
Right.
Then somebody offered me research money, so I didn't take up my place at the medical school. And then I really loved the research, and I thought I can maybe make a bigger difference by doing research and teaching other people in terms of managing, supporting people who had hearing problems, finding problems early, and maybe more prevention. So that was what I was naively thinking back in 1984.
Still would like more prevention and more intervention, wouldn't we? Yeah. Because that's really what we're interested in today and discussing, is like the impact that severe hearing loss has on communication and on the quality of life of people who are affected. And then, especially in the New Zealand context, I think the majority of us still don't realise the impact of severe hearing loss has on people. Yeah,
no, I agree. And I think actually probably most people are like I was as a child, had really no knowledge of hearing problems. Maybe some people know a deaf person, or they've seen people who use sign language, but unless they have a family member who has a significant hearing problem, or they went to school with people who had hearing devices or hearing loss, it is pretty invisible and pretty hard for people to understand. Whereas something like blindness, I think, is more salient to people. They can perhaps understand the challenges around that more easily than the challenges around hearing loss and deafness.
Yeah, and I agree with you, Suzanne. Until I started my position with the Pindrop Foundation, I hadn't come across individuals with a severe loss, and I would have had no idea the psychological impact. And I've really seen that with clients who, before they've had their implant, the difficulties they're facing, and then the difference that, having access to sound again gives them in their lives. It's just completely transformative.
I do remember, some of my early cases when I worked at the hospital, younger people who had jobs that they had to stop doing as their hearing loss progressed to the point where they couldn't use the telephone and they couldn't function in meetings with hearing aids anymore. And this was, of course, before cochlear implant technology sort of created that possibility for people with severe, profound hearing loss. So I do remember how distressing it was for me as a professional not to be able to help people to maintain their work and their life and their relationships, because as their hearing slipped away, for people who were born with hearing and then had this progressive, who were not signing people. They were talking and listening people, and then they couldn't do that anymore because their hearing deteriorated. Or in some cases they'd had an illness or an accident that had taken their hearing away. So very catastrophic changes in people's lives associated with losing your hearing to that degree.
And as you rightly said, Suzanne, I think, and quite a few people still ask, if somebody loses their hearing, why don't you just sign? So they don't actually understand they have someone who's been hearing and then to lose it. And that's the difference, isn't it? When you're immersed in deaf culture, and that's how you're used to communicating, it is then different for someone who has been hearing and to lose it.
Yes,
Yeah.
it is like saying, oh, I hear you're moving to Spain next week, and of course you can just learn Spanish, and no
Yes, of
problem.
course. Yeah.
So, you tomorrow you found out about this wonderful job in Norway.
Yeah.
Of course, you'll just learn Norwegian tomorrow.
Yeah,
So
that's I never thought about it that way. What a great way to explain it.
Yeah. So anybody some people, a small percentage of people are really gifted at learning spoken languages.
Yes.
And actually, I don't know about the evidence, like a visual sign language, of course, is in a different modality and in space rather than in time, auditory information. So I don't know whether you're gifted at other languages, whether you also pick up sign language. Probably it is about language in your brain.
Yeah.
But most people are not gifted at picking up languages. And the idea that, okay, tomorrow, this year, next year, you would become fluent in this new language. Most people would say, don't be ridiculous.
Yes.
I couldn't possibly do that. Maybe if I was a child, children learn so easily they could do it, but I couldn't do it as an adult. Yeah.
And I think as well, Suzanne, what they've mentioned, how the family communicates, their work colleagues communicate, their social. I mean, they're not in an environment where because to sign your friends and stuff must also for you to be able to communicate and understand someone. It's like if you go, as you said, if you went to Spain and you only had
but I mean one advantage of moving to Spain is that everybody is using that language, so you're immersed in it. So even though it would be horrendously difficult, if you were forced to only communicate in Spanish from tomorrow, you would pick it up within the year.
Yes.
Maybe we know you won't be a fluent native first language Spanish speaker, but you could sound, you would still have your accent, but you would sound, you would be able to communicate. But of course, if you lose your hearing and now you suddenly have to learn sign, you're not surrounded by signing people in New Zealand. The idea that they would learn to sign with you and you would retain and regain those relationships, it's just not realistic, is it?
No, it's not in the real world setting. And it's about a thing about choice. They want the hearing option and that solution made available to them, don't they? And and you said, like now when you started out in the 1980s, there was nothing, but now there actually is the technology, but it's now getting access to that technology and the distress that people are under because they know there's a solution, but because of access, they're struggling to get it.
So the sort of the distressing thing now is that there is a technological solution that is very effective for most people who have a more severe to profound hearing loss, but they can't access it. So I guess it's a different stressor from when you lost hearing and had no choice but to perhaps use written communication or learn sign language. Now we have an option, but it's still not necessarily accessible for lots of people.
And it's interesting. We went to the GP conference earlier in the year, and still the perception is it's just for children, that it's still not available for adults. And that was an interesting from the medical field. So there's a bit of work to be done in that to dispel that myth that's still around. And it was quite interesting. It was a bit of an eye-opener, actually. And
that is interesting. So but also maybe if you're a general practitioner, depending on the size of your practice, you wouldn't necessarily have a lot of clients, I guess patients. I'm not sure what medical practitioners call patients who are severely or profoundly deaf. So maybe you haven't looked into options for those people as a medical practitioner. Or maybe if you've lost your hearing, you're not going to the doctor as often as you used to because you can't communicate with your doctor.
And it's quite an interesting one because, the science, where the research has indicated that with people with a severe to profound loss are at increased risk of other health or other comorbidities and other health complaints. So therefore that would lead into the assumption that they would be visiting their GP more because of other associated health consequences from their loss.
I'm not sure if the paper was published, but I did review a paper, a large, looking at sort of insurance and medical databases, where they found that people with hearing loss actually were less likely to have diagnosed other medical conditions. Right. Some medical conditions in particular, I can't remember what they were, and they speculated that maybe because of the deterioration in the quality of the exchange between the person explaining their symptoms and the doctor doing the history taking, that those people with hearing problems were less likely to be referred on to specialists to get the diagnosis. So a sort of an impact on wider health literacy and engagement, because you can't have those good conversations with your doctor, because you may still have your speech intact, but you can't hear what the doctor is saying to you or pick up on the subtleties in what the doctor is saying. Yeah,
and especially if not everybody has a support person, someone to come along to a medical appointment and all those other things that then occur. So it's multifactorial. There's other issues at play. Yeah. So going back to basics, Suzanne, I'm not, a neuroscientist or a psychologist. So right back to basics. How does our brain respond to sound, and how is this perceived as speech? In a simple way, can you give us put you around the spot?
Okay. Wow, that is a tricky one. It is interesting because, of course, sound waves are just pressurized air molecules banging on your eardrum.
Yeah.
And so and then that causes your little bones in your middle ear to move. So it's all mechanical vibration.
Yes. Yeah.
And then the inner ear takes that mechanical vibration and turns it into a movement of fluid.
Yes.
Which then changes the position of the little cells that respond to sound, the hair cells. And that opens up channels in those hair cells that then changes the chemistry inside the cell and sends in, causes a trigger of an electrical signal in the hearing nerve to go to the brain.
Right, yeah.
Right, and we know there's thousands of those little cells, so our brain is coding all of the little changes in pitch and timing of sounds in a very complicated way in a healthy ear.
Yeah.
So this electrical signal is going up to the brain, representing the sound in time and space, because we've got two ears.
Yes, of
gives
course.
us space, loudness of the sound and pitch of the sound. So there's lots of
things going on.
Lots of things that are being delivered to our brain.
Yeah.
And then we have these very sophisticated hearing pathways. So the message from the nerve goes to the same side of the brain and also to the other side of the brain.
Right.
Mainly to the other side of the brain.
Crosses over.
Not fully, but so there is some redundancy.
Yeah.
And then that signal, that rich signal, is then coded at all the levels up the hearing pathways up to the hearing cortex in the brain. And that hearing cortex has connections with our language area.
Right.
It also has connections with our visual system and our motor system and our thinking part of our brain.
Yeah.
So, sometimes you can hear something but you didn't pay any attention.
Yes.
So until you say, "What are you talking about?" and they say it again, then you're like, then you get it. But your hearing was the same.
Yes.
You just didn't have your thinking part of your brain paying attention. Yeah. So you can hear sound, of course, while you're asleep and not thinking.
Yeah.
And sometimes it's so loud or startling you wake up.
Yeah.
And your brain gets aroused. But so your hearing brain is always working.
Yeah.
But your listening brain is only working when you're paying attention as well.
When you're conscious.
When you're conscious, yeah. So, and we know that when babies are seeing and hearing things, when they hear things repeatedly and in context, then those connections from the sensory cell in the inner ear to the hearing cortex in the brain, they get strengthened.
Right, it creates stronger pathways.
Yeah, so if a child has the opportunity to listen to lots of people talking to them in different accents, and to listen to music and to singing, for example, then their auditory pathways will be much richer in later life than if they had nobody talk to them. So people have done this with musicians. So if you're a musician and you got exposed to music a lot in early childhood, then your hearing cortex is much more sophisticated in its analysis of pitch, sound pitch, for example, and timing than if you never were exposed to music. Yeah.
It's amazing, isn't it?
Yeah. And the language pathways, because they rely on this rich auditory input, they are also enriched by lots of sound, spoken input. Now, the same would be true, for visual language, like sign language.
Yes,
if you've got rich visual input, that will make your visual part of your cortex in your brain also more sophisticated in its coding of visual signals and patterns.
Wow.
Yeah, so it is pretty amazing, but it does rely on you having this beautiful representation of sound coming to your ear and then going up to your brain, and then a healthy brain that can make meaning from it. Yeah,
that can interpret what the signals mean and integrate that into a coherent whole.
Yeah. So if you had rich hearing, and then you lost it, but then you got, for example, a cochlear implant to give you hearing back, it's much easier for that person then to suddenly feel like they're hearing normally again because their brain has those connections already. So you just have to give them back the sound and they can typically do really well. And sometimes nowadays, if somebody hasn't been deaf for too long, they can even get their sound through a cochlear implant and pick up a telephone and hear somebody talk, which you could not do if you were a child a deaf child who hadn't developed that sort of network through to the brain already.
So there would be, in childhood, clearly there's a sensitive period for that development to occur in the brain. Would that be a true statement?
Yes, we tend to not use the word, we do use a sensitive period. People used to talk about a critical period.
Yes,
but now we talk about a sensitive period, so that's optimal to have the input early, but it's not a disaster if it's not until later. Although probably there is a limit if you had no sound input to your hearing brain through all your childhood, which is the normal period of development of your hearing system, then you wouldn't have an expectation that that person would develop a hearing percept.
Yeah, because, the brain has been referred, especially a child's brain, having the plasticity and able to form and develop. And I have heard, you can correct me if I'm wrong, Suzanne, that a child's brain is much more plastic than an adult brain. So therefore, if a child would suffer a slight brain injury, they can recuperate. Usually the outcomes are better in rehabilitation than it is for an adult. The adult brain is not quite as plastic as a child's brain.
Yeah, that is true. And a young adult has greater brain plasticity than an older adult. Yeah. But having said that, we know that older brains do have plasticity. Yeah, so that's something that wasn't really understood. There was a view that, if you're in your 70s, for example, you never would benefit. For example, in hearing, you wouldn't benefit in your 70s from a cochlear implant, which we know is not true. Because people can regain their sense of hearing, and they can actually benefit from enriched sensory experiences if they're older, in terms of learning to discriminate between sounds if they have a hearing problem. So auditory training can be effective in older people as it can in younger people.
So when you mention auditory training, so therefore, is that like where we often hear where you can train the brain? It is like a muscle, so the more you put in, the better outcomes you're going to get, or is that too simple of an explanation?
Yes, I think the trouble with the muscle is it is just the one muscle that you are strengthening. Whereas in the brain, we have all these networks in our brain. So the input can, for example, improve your ability to discriminate between two sounds of different pitch. But for you then to use that in, to be better at understanding language, spoken language, you would want it to use more of your brain than just that hearing muscle. So there's lots of pathways to be. So repetitive training, for exercise is very good at strengthening a muscle. But to be the good athlete, you have to use your whole body. Right?
Absolutely.
So it's the same principle that you can listen repeatedly to the same sound, but to use it for good listening in everyday life, you have to use your whole brain. So you want to have training that's motivating and interesting and requires you to pay attention. So that's a good example in terms of thinking about sports training. It is a good way because it's because like thinking about the plasticity of the brain, like we have mentioned about, we've discussed hearing loss and plasticity in the brain. So what, Suzanne, actually happens to our auditory pathways in our brain, especially in an adult that has had hearing and they suffer severe to profound loss, need that be just over time or from injury or health reasons? What happens? So unfortunately, we know that the healthiness of the brain pathways depends on the continued input from the senses. So when you cut off the hearing input, when you lose hearing, then those pathways will start to decline. So we may lose neurons. So you actually, neurons could die because they're no longer stimulated. There is a little bit of research now that's shown after a long period of auditory deprivation, if somebody has a profound hearing loss and they don't get a cochlear implant, that there may be auditory parts of the brain that get activated by other sensory modalities. Anu Sharma's done a little bit of that research on cross modality. So instead of your hearing part of your brain responding to sound, there is no more sound. Maybe it will start responding to a visual stimulus. But that's probably only in people who are using their vision in a rich way for communication. So I think one risk of that research is people can think, oh, well, if you lose your hearing, you'll become a super lip reader. Which we know is not true. That actually lip reading is really hard, and people are better at lip reading when they get the hearing plus the visual pattern. Additional information. You put them together, and we have neurons in our brain that respond selectively to both a combination of hearing and visual stimuli. So then if you take away the hearing part, then they don't have that opportunity to integrate the information because it's only visual. So that, I think, has also been a bit of a myth that if you become deaf, then you'll become a super lip reader.
And even on that, Suzanne, we've all seen those hilarious videos that have been dubbed. So it's like, because it looks like they're saying what it has been dubbed, and they're absolutely ridiculous. So we have, there are
sounds in spoken language that look identical on the lips, right?
Yeah,
and so it's just not possible for somebody watching to figure out what it was based on the lip pattern.
Yeah, alone.
Lip pattern alone. Yeah. I did have a colleague years ago who lost her hearing through an illness that affected her hearing.
Yeah.
And she would become so frustrated because she was a really poor lip reader.
Yeah.
And people would expect her to be a lip reader, and she just couldn't really do it at all. And there is a range of typical performance, and some people are quite good at it, and some people are really poor at it.
Yeah.
And she never got any better. The thing that really made a difference in her life was getting a cochlear implant.
Yeah.
Because she was an auditory person.
Yeah.
She lost her hearing. She couldn't compensate really. She needed to get her hearing back with the cochlear implant.
Yeah, which I mean, it really whenever it gets to a severe to profound loss, that is their only option, isn't it, available to them to give them that full engagement. Because on that, now that we've just mentioned that, Suzanne, like, you've conducted numerous studies, Suzanne, with adults who have received a cochlear implant as a hearing solution. Can you just explain why hearing aids are no longer good enough for them and will no longer benefit someone with a severe to profound loss? Because oftentimes people don't get the difference. They don't know the difference between the two. Yes,
no, it's a good point. In your inner ear, when you become severely or profoundly deaf, a few people have completely lost all of their sensory cells, so there's no possibility of sound being coded and sent to the brain.
Right, yeah.
But that is relatively rare. It can happen, for example, in meningitis.
Right, yes.
Or maybe in an accident. But more commonly, people are losing the sensory cells and they just have a tiny bit of their inner ear that still can respond to sound if it's very loud.
Yeah.
And all the hearing aid can do is be like a loudspeaker and make the sound much louder.
Yeah.
And the hearing aid, because of digital technology, it can selectively amplify certain pitches of sound.
Right, yes.
So if you have most commonly people end up with a little bit of hearing for low pitch sounds.
Yeah.
Just because the part of the inner ear that responds to lower frequencies, lower pitch sounds is less vulnerable.
Yeah.
Yeah, so that doesn't always happen, but that's the most common thing. So you make those low pitch sounds very loud through a hearing aid.
Yeah.
And then the entire inner ear is sort of saturated with sound, and you have completely lost your selective hearing because you don't have all of those little hair cells to respond to the individual parts of the sound. So you can hear but not really discriminate between different speech sounds. If you know anybody or you do, people with severe, profound hearing loss, if they have some lip reading ability and they have a powerful hearing aid, they'll be able to figure out what you're saying.
Yeah.
But if they just were listening, they're hearing like a muffled version of speech, like like that with the loudness.
Yes.
But not the pitch and not the sort of the subtle variations in the tone of the speech.
Yes, the clarity of speech is really gone.
Yeah, the clarity is gone because there's no channels left to process it.
Yeah.
So it's you get a little bit people who are older who are used to having a car radio that had a bass and a treble.
Oh, yes, I remember, yes.
Or a stereo that had the bass and treble control. You could turn the treble all the way down and get this sort of mellow, bassy sound. So you just imagine an extreme version of that where you've only got the beat.
Right.
And you've lost all of the notes.
Yeah.
Then that's the extreme version of a severe to profound hearing loss, listening with a hearing aid.
Yeah.
So people will be able to detect sound with their hearing aids on at moderate levels.
Yeah.
And coupled with, careful, effortful listening and lip reading, you can get the message.
Yeah.
But it really is very effortful, relies on the person that you're talking with being a good, having good, clear speech, not too fast. If there's a whole bunch of people talking at once and you can't watch them all at the same time, then that sort of situation becomes impossible.
Yeah, and I think we spoke to a client on Monday, we were filming with him, and he said it's like he doesn't want people to shout at him, and then people, play with their lips, so it's keeping their hands away from their lips and being clear and enunciate, which help with the lip patterns and stuff.
But that's not normal behaviour, right? Mostly people speak from the other room, they all speak at once, they speak quickly, they talk on top of each other, they have their back turned.
Yeah.
So in regular life, you don't have like a newsreader type person communicating with you all the time with very clear, lip patterns and no facial hair covering their lips. And and that assumes that people even can lip read, because not everybody can.
As you mentioned,
So it is really that you've just got the volume without the clarity if you end up with that severe hearing loss and you have hardly any hair cells left in your inner ear. Yeah.
So then what happens whenever we eventually get a cochlear implant put in?
Right.
What then happens then, and how does that affect our speech perception and the auditory pathways? And
right.
Yeah.
So the cochlear implant basically ignores those sensory cells, those hair cells that are left, and it takes the sound, picks it up through a microphone, and it codes it into the timing and the loudness and the pitch, just like your hair cells used to do when you had them.
Yeah.
And it then takes that message and delivers it electrically directly to the nerve.
Oh, fantastic.
Yes.
Yeah.
So the implant part is that electrode array that the surgeon inserts into the inner ear.
Yeah.
And it wraps around the nerve. And now they do the surgery so that if there are some hair cells left, they may even survive, but they're not very useful. But the idea is that you then can access the nerve fibers that used to respond to the low, middle and high frequency sounds, and then you're sending back that rich signal back to the brain, and it's coded electrically, so the delivery is really different from when people heard acoustically. But the brain, especially if the brain used to hear, just takes that new electrical signal and says, oh, okay, I recognize this song. I recognize your voice. So it is pretty amazing how after a relatively short time, this really different electrical signal sounds natural to people who get a cochlear implant.
Because that's amazing, because oftentimes people do, when they first get switched on, when the implant gets switched on, that electrical impulse gives them a very robotic, they say it's very robotic, but then they do say over a short period of time that you've said it, it becomes as they used to hear.
As they used to hear. Yeah. So providing it hasn't been too long, right? Their brain will retain that auditory memory, and they haven't, if it hasn't been too long, then they haven't had too many nerve fibers die away. So if it's a relatively short time between losing your hearing and getting your cochlear implant and restoring that signal to the brain, then you still have that representation of sound that was there when you could hear in the brain, and that's probably one of the key reasons why it can sound natural and people can be so successful at discriminating speech, providing they haven't been deaf for too long.
Which is a really good point, because in New Zealand we do have lengthy wait times for cochlear implants. That goes against what the science and the research is showing us. It's more optimal because the outcomes will be so much better if they get implanted. What would be, if somebody has had a severe to profound loss, what would be the optimal time frame for them to get an implant? What would the research indicate?
So all we do know is that if you have been deaf for, 10 years or more, that we expect the outcomes will be significantly worse.
Yeah.
Right? So, but within that 10-year period, my guess would be that there would be a difference, and I'm not sure if people have looked at the data in this way. Waiting a year is probably better than waiting the 2 and 5, right? But the other thing is this is ignoring the other effects of the hearing loss. Right, so the hearing pathway effects are important, but the effect on people's well-being and income can be more dramatic if you lose your hearing. It's tricky, right, because the way you get a job is all geared towards being a hearing person. Yeah, you're expected to use a telephone maybe to make a job appointment, an interview, and then to have an oral interview. Right, with people that you've not met before. Yeah. If it's like a new job with people you don't know. So
and then the communication difficulties that arise because you're trying to impress that you could be a good fit and all.
Yeah. So actually if you have a hearing problem, the system is really stacked against you if you lose your job because of your hearing. The idea that you will get another job that requires less hearing, even if it doesn't require hearing, how do you get that job when you can't do the interview? I don't know if you do. You have that'd be interesting.
It would be interesting, and a couple of clients have brought that up actually. Because for whatever reasons they have lost their jobs or been made redundant. And then it's the process of trying to get another job. And it was exactly those points you've raised, Suzanne, with them going for interviews. It's just too difficult. And many of them then being out of the workforce for longer, it has then progressed on. They think then when they get their implant, things will change. And then oftentimes it does change. Or if their jobs have been at risk and they get their implant, they're much more immersed. And it depends if they've got a supportive work environment or not to begin with.
No, it's tricky because people lose their confidence quite quickly, don't they? If you're out of the job market, it can have a big impact.
And I think when you lose your hearing, and many of the clients have said this to us, were their social life and world becomes smaller because they stop going to things or stop putting themselves in certain situations because it's too difficult for them. And and it'd be interesting to hear your thoughts on, with your research, the impact of communication disorders, this being one, on people's mental health and quality of life.
Well, I think it's been hugely researched. It's pretty well established, there's strong links between hearing loss in adults and anxiety, depression, quality of life, confidence. So it's a pretty strong link. And most of the research has shown that in people with sort of less severe, profound hearing loss, but because that's the vast majority of people with hearing loss. So there's lots of research that shows that link with well-being from the mood and quality of life. But then once it becomes, if it's an acquired hearing loss and it becomes more severe, then it's complicated by other things, right? Because people's identity and their life, if it's linked to their work or their relationships with other people, the impact can be more drastic and more severe in terms of mental health. So then people become much more socially isolated quite quickly, I think. And then the person with the hearing loss will know that they can't answer the phone or they don't hear the door, or, everybody's talking about something and they can't hear, so they'll go and do something else, or they're just not participating. So that social isolation then can have a sort of a snowballing effect if somebody is feeling anxious or
of course.
Or having problems with sleep, which could be associated with depression, right? Then it can snowball if it has all these effects on their relationships, which are the things that will keep them well.
And then like the research then countering that in the clients we've seen and worked with, once they get their implant, it isn't just the fact that they're auditory nerves with stimulated and they're getting access to sound and speech perception. It is the world is opening up again, isn't it? And that's
And those people who found it so difficult to communicate with them before will be like, wow. And they'll and so
start engaging again.
Engaging again. So that should have a positive snowballing effect in the other direction. But only if it hasn't been too long, right? Because people will, if everybody's slipped away, then it's too late to bring those relationships back.
Which is very true, because they do, go to the side, and through no one's fault. It's just the way human nature is. Well, so we'll try and leave this on a positive note, Suzanne. What do you think the future holds for those, in New Zealand who have got a severe to profound loss, and now there is a treatment option available to them? Do you think the future is looking brighter for them?
I think so. I have thought about this because it has been disheartening to be a person who values the technology and is impressed by where the hearing technology has got to, but to know that in this time people still don't have access to it. So I think the technology the surgery is becoming more straightforward. Right. So the surgical costs have reduced. The surgical burden has reduced. So actually, it's a much less daunting procedure for people than it used to be. I think the more people can know about the wider possibilities for cochlear implants, because it used to be that it was regarded as a drastic option, right? Because and I think that was partly because in the early days, the surgeons were being very careful, and it was a much more major surgery than it is now. But I think really that's about audiologists and general practitioners, like health practitioners and regular New Zealanders, right? Learning about this is an accessible technology, and if you have that, not just a profound hearing loss, but a severe hearing loss that's deteriorating, that you should be going to see an expert team. And we have high hopes that the evidence of the effectiveness of the intervention is going to turn around people who make decisions about funding. So I am optimistic. We know a lot about the speech signal. We know a lot about how sound is coded in the brain, and we've made sort of dramatic gains in the past, but now smaller gains in terms of the sound quality. But the gains are so dramatic. There's all kinds of interesting research for the future about, making the technology more sophisticated with the cochlear implants, so that you reduce the inflammation and get a better result in when the implant goes into the inner ear. So we just need more people to get it, and we needed them to get it earlier while they're still engaged.
Professor Suzanne Purdy, thank you so very much for your time today. You've given your time so generously, and thank you for all the amazing work and research that you've done to date and changing the lives of many New Zealanders. Thank you.
Thank you.